I'm trusting your process.
Serving 885,000 people, Island Health's focus is the health and wellness of the residents and communities on Vancouver Island and in surrounding coastal communities. Our diverse geography spans 48 settler communities and 50 First Nations, from the Zawadenu people of Kincombe Inlet to Victoria, from Tofino to Comox. We acknowledge with respect and gratitude our privilege to provide health and care services on the traditional unceded territories of the Coast Salish, Kwakwaka'wakw, and Nuu-Chulnith cultural families. The Island Health family includes 30,000 healthcare professionals and 1,000 dedicated volunteers. Over 3,000 doctors, nurse practitioners, midwives, and dentists make up our medical staff. We provide health and care services at 145 facilities with more than 6,700 long-term care beds, over 1,600 mental health and substance use beds, and more than 1,800 acute care and rehabilitation beds. Island Health has an annual budget of $3.9 billion. Each year, this funding supports 561,000 visits to emergency departments, more than 73,000 surgeries, nearly 60,000 MRIs, 158,000 CT scans, 2,100 telehealth visits, more than 85,000 visits to urgent and primary care centers, over 17,000 home health monitoring visits, 314,000 visits to ambulatory clinics, and 478,000 home health care visits each year. Island Health has expanded our primary care services with 23 primary care sites across our region, including 7 Island Health urgent and primary care centers and 9 primary care networks. Under the leadership of 6 medical health officers, Island Health works to promote health, prevent disease, and improve quality of life. Each year, we conduct more than 2,000 inspections of childcare facilities, 500 inspections of licensed care facilities, and 5,400 inspections of food service operations. Our public health nurses provide nearly 6,000 perinatal home care visits and 30,000 childhood immunization appointments. From birth to end of life, Island Health strives to provide excellent health and care for everyone, everywhere, every time.
I always appreciate watching that video because it reminds us of all the services we provide to the people of Vancouver Island and the surrounding islands. I'm delighted to welcome you here today. My name's Leah Hollins. I'm the board chair for the Board of Directors of Island Health. And on behalf of my colleagues, welcome to the public forum, whether you're joining us in person here at the Cowichan Exhibition Park in Duncan or online through our live stream. I acknowledge with respect and humility the traditional unceded territories of the Cowichan tribes and the neighboring nations of Chemainus, Penalicut, Liaxin, and Hullut. I'm so grateful to be able to yet again introduce Elder Albie Joe Charlie of the Cowichan tribes, who will start our meeting with a welcoming message. Albie?
Ai nei te sia na sia ia Good morning, friends. I'm going to say relatives, because when we work together for such a facility, we do, and it's important to become a family. The foundation of this facility will be respect and meaningful relationship. And this is the way that we're going to start with this. Cowichan Tribes has always been working closely with Island Health, and we continue to work together in a respectful manner. Because from now on and forever, we're going to be walking together and doing things together to make things better for all our people here. And this is a good beginning to show our youth and our young people the true meaning of respect, of not working together in a respectful manner. I've met a lot of you during this working process, but I'm always excited to meet new friends, because it means so much to us. So, in that, I welcome you to Cowichan Tribes territory, and I know that we have a long future ahead of us of working together. And it's good to see a friend Ron, and I'm not going to say old friend, she's behind me.
Thank you.
So, welcome to Cowichan territory, and I have to apologize. I have other commitments to make, and it's been quite busy, and I have to share this also, that Cowichan Tribe has experienced a very, very hard 2 months. In 2 weeks, we lost 9 members in Cowichan territory alone. So we went through a real tough time, but because again of this respect and working together, we're still moving forward. Hi, Cowichan. Good to see you all.
Thank you very much, Alvin. We really appreciate you being here. I'm really sorry to hear about your losses. That's awful. We are so grateful for being able to work, live, and care within your traditional unceded territory. So thank you yet again. And we'll see you later this afternoon, because I know you've got a very busy schedule.
Yeah, okay.
Thank you.
Thank you. You.
Escuela.
Good day.
Albie also tells a story about a hummingbird, which I hope he'll tell us this afternoon, because it's a really learning opportunity. I also want to acknowledge that we serve the communities of Didadat, Pachadat, Subaset, and Malahat in this region. And I recognize the Inuit, the away-from-home urban Indigenous people, and the Métis chartered community to whom we provide services. We do this to reaffirm our commitment and responsibility to improving relationships between nations and cultivating our own understanding of Indigenous peoples and cultures. Please join me in reflecting on the harms done, such as the cultural genocide and assimilation of Indigenous peoples, the residential school system, and the discovery of graves of Indigenous children who attended them, the Indian hospitals, the too many missing and murdered Indigenous women and children, and the social inequalities and racism which exist today. I invite you to think about our responsibility to act in a spirit of reconciliation, healing, and collaboration. As a healthcare organization, Island Health is committed to cultural safety and humility. We demonstrate this through our actions to address Indigenous-specific racism, systemic racism, and ongoing impacts of colonialism. Excuse me. Public forums like this allow the board to meet people in communities we serve and are essential to our commitment to transparency and accessibility. Our time together will help us better see what matters most to you, and so we can increase our understanding and refine our thinking. As a governance board, we are responsible for the overall direction of Island Health. The Minister of Health appoints the board, but we each choose to sit on the board because we deeply care about health and care. As a former nurse, a Deputy Minister of Health, and Chair of Canadian Blood Services, the patient has always been central to my work. I always ask myself, is what I am doing right for the patient? Caring for patients is why I started working in healthcare and frankly why we are all here, why we exist. Caring is also why every member of the Island Health family is dedicated to delivering Island Health's vision of providing excellent health and care for everyone, everywhere, every time. It's now my pleasure to introduce you to our board of directors who are responsible for the overall direction of Island Health, as I mentioned earlier. Albie already mentioned Ron Rice, who's a member of the Cowichan tribes and lives in Victoria. Shawnee Cassavant from Hupetchet and Seychot First Nations on the West Coast. Ann Davis from the Comox Valley. Ann McFarland from Victoria. And unfortunately, we have three members who couldn't be here today: Ron Matson from View Royal, Andy Adams from Campbell River, and Diane Brennan from Nanaimo. So we normally have 10 members on our board. We're short 2 at the moment, so we're waiting for 2 new appointments. We also have our local leadership and executive management team members joining us today, and you will hear from some of them later. We have a very full program today. Thanks. Dr. Réka Gustafson, Vice President of Population Health and the Chief Medical Health Officer, will speak about public health and wellness in the region. We'll then have a presentation on the new hospital emergency department from Shane Supia. Am I close? Excellent. From Park and Architects, and Dr. Pat Gallagher, the Medical Director of the Cowichan District Hospital Replacement Project. The last part of the agenda will be an opportunity for you, community members, who have come to our meeting or submitted questions by email in advance. I will open the floor to questions so the board can hear from you. First, though, I want to invite Island Health's President and CEO, Kathy MacNeil, to begin by providing an update on the delivery of health and care services across Vancouver Island and here in the Cowichan Valley. Kathy?
Thank you, Leah. Good morning, everyone. Thank you for being here with us. And I know Albie is a busy man in demand. I would like to just acknowledge and thank him for his partnership and graciousness as we work together to build this new hospital and address the health and care needs of Cowichan tribes and all of the nations here in the region. I also acknowledge the people who are taking the time to join us virtually. So there's those of us in the room, and the pandemic has brought us these new tools. We can gather together virtually, so we have folks joining us online. I'm grateful to be here in Cowichan Valley so soon. We were just here 7 months ago, and our board held some engagement here at that time. And we've come back so quickly because we are excited to focus on the new hospital. And so that's what's brought us back into the region so quickly. Last time we met, we talked about the Cowichan Health and Care Plan and how it's helping to improve health services here for the people in the region. When we started to plan for the new hospital, we identified that community services that citizens needed to have in place actually were one of the reasons why people were staying in hospital longer. So knowing that we had to make plans for this new facility, we thought we better put those services in place in the community first before we build beds for people when they should get better care in their own or in the community. So that's what we've done in the health and care plan. Those services have been invested in here in the Cowichan Valley, and we are seeing changes in the way the hospital beds are used in terms of occupancy as a result of those investments. There have been shorter wait times for the emergency department and for geriatric assessment, increased home nursing visits, and decreased admissions for chronic obstructive pulmonary disease, COPD, because we have respiratory therapy available in the community now. The award-winning innovative short-term enablement and planning suites, lovingly known as STEPS, that's a program that gives Cowichan residents a place to transition temporarily between hospital and home. We've expanded those beds to 14 beds to meet the demand here in this region, and we've taken this model into other communities on the island to repeat these positive impacts. I just need to make note, I'm very aware of the privilege I have to speak to this work, and I'm also very aware that the people who've actually done this work are here in this room. They're not me, they're the tremendous members of this team that you have serving you here in Cowichan Valley. We've increased palliative support in the community, including expanding hospice beds from 7 to 10, which has resulted in up to 90% of palliative clients now experiencing the end of life in the community in the way that they wish to do so. Overall, the Cowichan Health and Care Plan has enabled us to free up 18 beds a day in acute care and has consistently kept the Cowichan Hospital occupancy rate below 100% in the last 18 months. That's an achievement almost unheard of in today's highly challenged healthcare environment, where demand for services continue to outpace our ability to step into that. From April 1st of 2023 to January 2024, just last month, nearly 26,000 patients have gone through the current hospital's emergency department, which is slightly up compared to last year. Anybody who's been to that can imagine the challenge that that must be presenting. I want to thank the staff and clinicians at the Cowichan District Hospital for their ongoing commitment to delivering excellent care in those circumstances where we know that infrastructure is so challenging. I also want to recognize surgical staff and the physicians at the hospital. This past year, Cowichan Hospital completed 43,091 surgeries, almost 10% more than the previous year, and we know the demand for surgery is great. Approximately 95% of the patients here in Cowichan Valley are getting surgery within 36 weeks. We know we have a long way to go to strengthen surgical programs further so that we can meet the needs of all patients who require that surgery. I'm very proud, though, to point to the work of the surgical staff and physicians here at Cowichan District. They're doing the right things. Like many areas across the island, shifting employee priorities has affected the Cowichan Hospital. Retaining and sustaining the workforce at the site has been and continues to be a challenge. Over the past few years, the leaders at the hospital have increasingly required a to close the gaps and address sustainability to ensure the workforce is resilient and ready for the future. Over the past 6 months, 33 new nurses have been hired at the hospital through a focused recruitment campaign in nursing. These staff, many of whom are recent graduates, will join a team preparing to transition to an incredible new facility. And we can see why they would want to work in such a beautiful and diverse community. Speaking of the new hospital, the board of directors and our team will tour the construction site later today, and I look forward to seeing the progress that's been made firsthand. The new hospital will be suitably equipped with new technology, and it's been thoughtfully designed by members of your local care teams, patients, and Indigenous partners to meet the current and future healthcare needs of people here in the Cowichan communities. The new hospital will see its critical care, labor and delivery, child and youth care spaces double, with more operating and procedure rooms, more inpatient rooms, more mental health and substance use care spaces, including a pediatric mental health substance use area, medical imaging and diagnostic equipment, and an emergency department that will see an expansion from the current emergency department that has 17 care spaces to one that has 45 care spaces, which you'll learn about in a few moments. When the hospital opens in 2027, all of these enhancements and many more will transform the ways that we are able to provide health services and provide that care to patients that they deserve. We're incredibly proud that the new hospital here will be the first fully electric, fossil fuel-free, try saying that 3 times, fossil fuel-free hospital in British Columbia, with an 80% reduction in operational greenhouse gas emissions compared to current hospitals. And we know as an industry, healthcare is not being kind to the climate, so we have our responsibility to step into. Taking care of the environment is important when we are taking care of people. The Diagnostic and Treatment Center, the Inpatient Unit Tower, and the Service Center are all progressing on budget and on schedule. So for you builders in the room, that's a very important accomplishment. And the site teams are now working on the exterior envelope of these structures, so there's actually something to look and see. This morning, we had breakfast with our Construction Alliance partners who have played a crucial role in delivering the Cowichan District Hospital replacement project using a unique project delivery model. This collaborative model is designed to have all our partners working together to ensure the new hospital best serves all of its future patients when it opens in 2027. Interdisciplinary teams of staff, physicians, patient partners, and an Indigenous Advisory Council have all been working together to ensure the new hospital provides a welcoming place of healing and hope. The Indigenous Advisory Council, who we'll be meeting with later this afternoon, includes participants from Cowichan tribes, Dididat, Pachidat, Subaset, Malahat, Penelakut, Liaxin, Stuminas, and Halalt First Nations, the Cowichan Valley Métis Association, and the Hi'etlalum House of Friendship, which serves the urban Indigenous population who live here in the valley. The Council has been providing valuable guidance, review, feedback, and endorsement on various aspects of the project from an Indigenous perspective. Through ongoing engagement, Council members have shared cultural connections and protocols for all elements of the new hospital's design and construction. As the project evolves, the Council will continue their support through further engagement on decisions related to operational readiness, moving forward together on opening day and beyond, just as Albie spoke to. I'd like to thank the members of the Alliance, the user group staff, physician participants, the Cowichan District Hospital Foundation, the community members, Indigenous Advisory Council, and the many members of the site crews who every day are contributing to their incredible work to helping us get this new hospital off the ground and open for you. I'd also like to thank patient partners, auxiliary, Cowichan tribes, the Cowichan Valley Regional District, Municipality of North Cowichan, and the Province of British Columbia for their significant contributions financially and support to this important and much needed community resource. A new hospital will be an incredible space to receive care in, as well as to work and learn. However, as said earlier, the effectiveness of a hospital is directly related to the relationships developed between the hospital members and the primary care providers and other service delivery partners in the community. Since its establishment in April of 2020, the Cowichan Primary Care Network has connected more than 8,000 people here with primary care providers. When the service planning began for the Cowichan Primary Care Network, the identified gap in the community was 17,000 people who were not connected to primary care. There are 81 family physicians and 18 nurse practitioners in the Cowichan Valley, and efforts are being made every day to attract more to the region. We've succeeded in introducing team-based care with 13 social workers embedded in primary care practices in the area. The social workers help to address the social determinants of health. They provide access to information and resources and make positive changes for patients across the region. In addition, the primary care network pharmacist has been a wonderful addition to the primary care teams, conducting medication reviews and meeting with patients about their medications. And we know how important that is for seniors who might be have frailty and be living at home. We know there's a continuing need for primary care access after hours on the weekend. Work continues with the Ministry of Health and the primary care network partners to help improve this access. Like many communities, we know another challenge here in the Valley that the Valley faces involves mental health and substance use. And we've been working with many partners to provide solutions, including providers for addiction medicine, primary care, and outreach services. The Assertive Community Treatment Team, or ACT team, has been enhanced to provide services to people in smaller surrounding communities, people who may not be in the core. We've also embedded a community response service in the emergency department at the hospital. The Cowichan Valley Wellness and Recovery Center was developed in response to the ongoing toxic drug poisoning crisis. The center was established to help people who are living with substance and mental health challenges and to provide opportunities for life-saving interventions to prevent overdose and death. Many people access the service and receive safe supplies to help protect their lives. These can be harm reduction supplies, prescribed safe supplies, supervised consumption services, and a space for safe inhalation or smoking of substances. Enabling access to primary care and addiction medicine and nurse practitioners has reduced the number of people presenting to the emergency department for primary health concerns. On-site primary care has also increased the number of people prescribed pharmaceutical alternatives, a step toward recovery. At Island Health, you've heard already, our vision is to provide excellent health and care for everyone, everywhere, every time. This guides the hardworking and dedicated Island Health teams in their work every day. And we know we have work to do to bring this vision to reality. Local collaboration and partnership makes all the difference. I know our teams appreciate the support and interest of this community in their work. And I speak for my leadership colleagues when I say how grateful we are for the partnerships and collaboration here, how proud we are of this team that serves the health and care needs of Cowichan Valley so well. So now I'd like to hand the podium back to Leah.
Thank you very much, Kathy. And it's now my pleasure to ask Réka Gustafson to come to the podium. Réka is the Vice President of Population Health and our Chief Medical Health Officer, and she's going to provide an update on health and wellness of the population in the Cowichan Valley. Réka?
Hi, everyone. Thank you for having me, and it's my pleasure to give the public health update today. And whenever I give a little bit of a presentation, I sort of need to stop and think about what's the story that we're telling. And I think today's story is really about how we're experiencing health locally and how we're affecting health locally in the context of a number of global public health crises or issues. And I think I'm going to stop calling them crises and emergencies because I think they're our long-standing reality. And given that I'm going to talk a little bit about local public health, I do want to, first of all, gratefully acknowledge the traditional unceded territories of the Cowichan tribe, where I have the privilege to speak with you today. And also just remember that I'm not your local medical health officer. Your local medical health officer is Dr. Shannon Waters. And some of the strengths and the work that I'll be highlighting today is really coming out of her partnership with the community here. And we look forward to her return. So thank you. So I'm going to start with the first of the three public health issues that we are all dealing with, of course, which is the toxic drug or the unregulated drug poisoning rates in our population. This graph is showing the rates of mortality and I believe, I realize number of deaths, the number and the rate of deaths due to unregulated drugs in island health. It's comparing us to other health authorities, and basically our rate of mortality is similar to other health authorities, and the differences are reflecting the different size of the populations. We lost 2,511 people to unregulated drug poisoning in British Columbia in 2023. 470 of those were in island health. Next slide, please. But one of the things I'd like to share with you is what's happening in Cowichan Valley, which is that rates have actually stabilized and in fact declined a little bit after the pandemic in this area. That one death is too many. This is not to say that the issue has been solved. But what it does illustrate is that if you look at the curves, they're really quite different throughout Vancouver Island, throughout the province. And that means that the actions that are being taken locally are actually having an impact. And some of the actions that are being taken locally, I'm going to speak about in a moment. Next slide, please. But before we do that, I do want to just reflect on what's actually happening on our population. The top graph is showing you the age groups that are most affected. And we'll see that mortality is highest in the 25 to 44-year age group, followed by the 45 to 64-year age group. And a distant third is those who are older. What that means for us is that people are being affected in the prime of their life. And I will move on to a second graph. What that means in terms of the potential years of life lost in our population. We continue to see men disproportionately affected, but of course we are also seeing some increases among women. Next slide, please. We're also seeing one of the things that's, I think, important when we consider our services is the disproportionate number of deaths that are occurring in private residences. 2/3 of deaths are occurring in private residences as opposed to other residences, other inside or outside. What that is reflecting is the fact that if you overdose, and we want to prevent an overdose, any kind of overdose, but if an overdose occurs, it can be reversed if somebody is with you when you are overdosing and they have the skills and the equipment to help you reverse that overdose, which is an naloxone kit. Next slide, please. And so there are many ways that Cowichan Valley is addressing this crisis. The overdose prevention services, a site is one of them, but there are many overdose prevention services provided within the context of healthcare and outside the context of healthcare. Drug checking, which is actually a really important intervention that is trying to counter the fact that the reason that the drug supply is toxic, the reason that people are dying is because that drug supply is unregulated, which means that unlike anything else that we put in our body, whether that's food or drink, people who are consuming these products don't know what the contents are. And drug checking is one way to try to counter that. I have an ingredient list on my crackers that I opened in the morning, but there's no ingredient list on illegal drugs. And so drug checking is trying to counter that by giving people some understanding of what might be the components of the drugs they're consuming. And then some of the primary care services are really needing to integrate and are integrating the kind of things that address the challenges faced by people who use illegal drugs. So providing safer supply, replacing that toxic illegal drug supply with a safer alternative is going to reduce harms, including death. Nursing supports and peer supports to make sure that people have the ability to connect to the supports that they need to address the social determinants of health that are affecting their lives every day. And outreach to start to recognize the fact that services that require you to find, navigate, and walk through the door of a healthcare service can be too high a barrier for many people, especially they're mostly struggling. And all of this has to occur in the context of partnership. I think one of the things that often gets misconstrued is when we talk about addiction being a health issue as opposed to a criminal issue, that is interpreted as that it's a health service issue. It is a health issue, but it's an issue that can only be addressed through partnerships that address education, adverse childhood experiences, housing, and all the other things that affect people's lives. I do want to say one thing, though, that I think Cowichan Valley is a part of and Island Health is a part of. This colorful graph, I'm a public health person, I like graphs. This colorful graph shows the visits to overdose prevention sites in the province. And I would like to point out that Island, this is the absolute number of visits. And Island Health, being the blue line, is actually only slightly lower than Fraser Health and higher than Vancouver Coastal Health. And given our population, that's actually a very high rate to visit to overdose prevention services. And one of the reasons that happened is because Island Health is using our data to understand what kind of services people need. And Island Health actually has a good number of inhalation sites. And most people are now consuming drugs by inhalation. Most deaths are occurring through inhalation. And establishing inhalation sites means that we are actually providing the service that people need in order to address their risk. So that's where we are with that's my update around the current state of the unregulated drug crisis. There's a lot of conversation about this, and it's a very complex issue that we're going to be with for a long time that we need to address through prevention, through harm reduction, through care and services. And all of that is going to need partnerships. And I just want to really go back to that first graph we showed, that in Island Health, Cowichan Valley is really putting the services in place that are addressing this very complex problem. We're nowhere near there, but I think we're working together very well. Next slide, please. The next one is of course, the COVID pandemic that was mentioned before. And I wanted to share this colorful graph with you, just mostly because I like it. I think it's really quite nice, but it actually is showing what kind of respiratory viruses are being diagnosed and isolated in the province. And apart from the fact that I like the colors, it does actually illustrate a number of things. So the purple is COVID. And one of the things you will see with COVID is that unlike some of the other colors, it's not fluctuating as much. And so what we're seeing with COVID or coronavirus is that it's actually, although there are waves of viral infections, it's actually not settling into a typical seasonal pattern like influenza and RSV. But what it has done is that there's a background rate of coronavirus, but because of immunization, its impact on our health system is actually much less than it used to be. What you will see is the blue, which is influenza, and the red, which is respiratory syncytial virus, which are much more seasonal viruses that have now actually started to settle back into their usual seasonal pattern. Next slide, please. And so that's what the red lines are. One of them is the hospitalizations due to influenza, and the other one is hospitalizations due to RSV. And the reason I put that up is just for us to bring back to what these viruses actually do normally. And what they do is that we have seasonal patterns, and those seasonal patterns affect us as individuals and affect our healthcare system as well. And to remind us all of the importance and the effectiveness of vaccines, especially for influenza. And now we have an RSV vaccine that is going to be available, and we expect a recommendation from the National Advisory Committee on Immunizations. What really I wanted to say about the pandemic is I hope this is the last time I give an update about the pandemic. That is one issue that we are starting to be, we're very much on the other side of. Coronavirus is going to be with us probably forever or for a very long time. That's what novel viruses do. They emerge, they have a significant impact on the population, and then they become endemic viruses. And that's where we are with coronavirus today. We may have worse years, we may have better years, but it is something that's really important for us to also, I think, follow the data and recognize when a particular issue is no longer the primary issue that we need to be dealing with. And I think the reason it's important is actually partially for our mental health and well-being. We have so much been in the rhetoric of crises that we sometimes need to actually look at the data, say, are we still in that? And this one, we really have gotten to the other side of. Next slide, please. So then the third issue that we're all dealing with, and I'm actually going to look at my notes for this one because I think it's really important, is of course climate change. And climate change, there are a number of things that we're working together on. In Island Health, we now have a climate change unit. We are working with our facilities and public health to combine what we can do within our healthcare facilities to reduce our greenhouse gas emissions, but also work with communities to assess community readiness and to address issues that we are facing. We're working with you and our municipalities for extreme weather events, for preparation of extreme weather events. We've just been through one. But one of the things I'd like to highlight, because Cowichan Valley had such a significant role in it, is the climate gathering that occurred about 2 weeks ago. Was it about 2 weeks ago? It was such a privilege to be part of this. This climate gathering was really a novel approach to address, again, a local approach to a global issue and how to find a common path forward with our communities, our Indigenous leaders, and the healthcare system. And I just want to really express my gratitude for this was an island-wide gathering, the gratitude for the Cowichan Valley leaders and how they contributed and led this meeting. We had Jennifer Altcroft, a climate change specialist from the municipality of North Cowichan, who was an active member of the program advisory committee. We had an amazing presentation by Chief Lydia Whitsom and Mayor Staples about the Cowichan Watershed Board, which was demonstrating two things: a co-governance model, as well as a simultaneous addressing of a climate change and community health. I learned a great deal. So I just really want to, again, highlight the importance and the possibility of local leadership and local ability and local data to address a global issue. And so my last thing I'd like to talk to you about, next slide please, is how we arm ourselves in order to address global issues with local action. And the example of that is the Our Health, Our Community survey, which is something that is, again, being done locally to address, to find granular data that is collected, interpreted, and used with community leadership and community wisdom as at its center. Next slide, please. So the last time we were here, we talked about the beginnings of this survey, and the data collection has now completed, and this is just a summary of the respondents. How many people responded, who responded. We had more women than men respond. We had a good sampling of people in their middle years, and just the distribution of the characteristics of the people who responded. Next slide, please. Right now, with the leadership and collaboration of our community advisory, the priority indicators by theme were identified, and their environmental health, housing, mental health, substance use, and transportation. And the really important thing about this is that these are the priority themes for analysis. So analyses will be available in April to be able to start gathering around this data, interpreting this data together, and to really give us the tools to take take action on the local public health issues based on the leadership of the community. So I can't tell you how rare this is. I cannot tell you how difficult this is. Most of the data that we present to you is secondary data, comes out of healthcare system or some other use, but the ability to proactively collect data in a community to empower the community to take action is a really, really unique achievement. And like Kathy was saying, I'm celebrating someone else's achievement. But it is a way for us to address public health issues with information in our hands. So thank you very much for your time, and I look forward to the conversation.
Thank you, Réka. Réka always reminds me when she speaks, or one of the other medical health officers speak, how terribly important public health and population health are. We have clean water because of them. We have vaccines because of them. And there's all kinds of, I could go on and on about it. It's really important. And so many of us want to talk about acute care all the time. But really, population and public health is really, really important to us. So we're now going to move to a presentation on the hospital's new emergency department, or the new hospital's emergency department. I just want to say that our board may have questions for the presenters, and they will be able to ask those immediately after the presentation. And then we'll take questions from the audience at the end. And I'd ask you to save your questions until then, if you would. Our presenters are Shane Supeya. Is that close? Or closer? Good. From Parkin Architects, and Dr. Pat Gallagher. So welcome to the podium.
Thanks everyone for joining us here and having us to speak about the emergency department of the new hospital. So for those of you following our project through these community updates, we held a Zoom audience poll at the end of our October session, and the emergency department was the overwhelming winner for care areas that people would like to hear more about. So here we are today to share more about that with you today. We want to thank everyone who voted, and we also would really like to thank the emergency department user group, our patient partner volunteers, and members of the project's Indigenous Advisory Council who've all contributed to the process of design that we're going to share here today. Next slide, please. So one of the first things that the Alliance partners, Island Health, BCIB, Infrastructure BC, Ellis Don, and Parkin Architects did when we came together and began working on this project was to create a vision statement that we aspire to achieve every day as we work towards a really groundbreaking project, and that is to create the most welcoming place of healing and hope. Next slide, please. This image maybe looks a little confusing. It looks like it's been a bit garbled. Apologies for that. But this is an overall aerial view of the site from the northwest. Imagine yourself on the top of Swakis or Mount Prevost, that's just behind this building here, looking down on the site. In the foreground, you see Bell McKinnon. Well, that would be right here. And then this road along, going to the northwest, is a new hospital road north. And I'll just maybe point on the screen what you should see encircled. So that is the emergency department entrance. It is one of the first things a visitor sees when they arrive on the site. Next slide, please. So these images here show the original design from 2022. The drop-off location was along the edge of the parking lot in the left image, and the design incorporates a covered entrance, which is an improvement on the existing access at the current CDH for pedestrians. But it does, in this design, present a 37-meter walk from the nearest parked vehicle underneath a covered canopy to get to the triage desk. So we heard in feedback in our engagement sessions that this presents a pretty daunting walk for a patient who's coming in a distressed or injured state. Next slide, please. So now these slides show the updated design, and the plan on the left shows how we've responded to this feedback. A vehicle will come onto the site, and we've extended the parking to go up along the long edge of that canopy. A car showed in orange can park right next to that main entrance door to the emergency department, indicated with that yellow arrow. It significantly decreases the length of walk to the triage desk from someone getting dropped off. And also not shown in this rendering is we'll be adding a second red emergency sign along that long edge of the canopy so that it really clearly communicates where you find the emergency department. Hand it over to Pat. Next slide.
Thanks, Shane. So when we first started designing the hospital, we looked at Emerge and we had to decide what sort of model of care we would be providing in the hospital. And there are really two models of care, streaming and traditional. So this is a schematic showing this is the D&T building in the north here, the inpatient unit tower, the reach out building there, and the upper colored area is where the Emerge is. So this is, as was mentioned, goes from taking the current hospital of 17 actual sites for people to be cared for. They use often in the mid-30s for that. But we now will have 45 spaces in an area 3 times as large. You can see the main entrance there at the green arrow to Emerge, the main entrance from the west side to the building at the red arrow, and the ambulance garage for 4 ambulances at the top there. Next slide, please. So looking at the traditional model, this is a model where patients come into the hospital, they're triaged at the desk, they are then sent to a waiting room and eventually get called in. And this tends to make us less efficient because it penalizes those with smaller concern problems. They wait many, many hours, and we all hear people waiting 8, 10 hours, this sort of thing. And we had a strong push from the emergency department user group, Tracy Stephenson among them, to select a streaming model. This was supported by our literature review, the provincial scan, and our GH and VGH currently on the island. Next slide, please. So what happens? A patient comes in, they're assessed at triage here. They are then, next slide please, if they are a minor laceration, a minor fracture, upper respiratory infection, that sort of thing, they would go into the streaming waiting area here and then be brought in by the care team that works in that specific area to have their service provided. Next slide, please. If they have a life-threatening illness, they may come through triage, but more likely they'll come from the ambulance garage and they'll go directly to the trauma rooms. Next slide, please. If they are having a serious medical condition, a heart attack, sepsis, something like that, again, they'll either come from triage or the ambulance garage, and they'll go into the acute care area. This is, in our current CDH, we have 5 beds for these patients. This has 24 beds. And they're all individual treatment rooms with monitoring capacity. Next slide, please. If they are having a psychiatric issue, again, same 2 pathways from the triage or from the ambulance, but here we also have a northern entrance, so someone accompanied by the RCMP can be brought into that area. Next slide, please. The other thing we looked at was in the emergency department, which is a real change from the current site, is the embedding medical imaging right into the department. So that we saw in Nanaimo how well their X-ray unit was functioning within their emergency, and so we located a general X-ray unit right beside fast-track streaming. We also saw in the North Island how useful it was to have the CT scan right adjacent. So we placed one of our CT scans. We have two in the new building. One of them will be right here as part of Emerge. The other one actually is right there, so they'll have operational efficiency. We also, sorry, one last thing. We also are considering whether or not we will be placing ultrasound in the department as well.
Next slide, please. So this is the emergency triage mock-up user group. We're going to show the process that we've gone through to develop the design for the triage itself. But this is also a really good example of the process we've developed to design spaces throughout the entirety of the building in many departments. So the design teams met with emergency department user groups, which includes Island Health project team leaders, Island Health emergency management, as well as frontline staff such as protection service officers, ED, triage nurses, physicians, registration, admitting, and switchboard, and others. This is a really wonderful photo of some smiling faces. The reason they are very happy is they've just completed the final fully constructed mock-up review, which is the culmination of a lot of effort over many months that's resulted in a really terrific, innovative final design solution. At the bottom of the page here, you can see Tara, the clinical nurse leader, who's a really critical member of this user group, and she shared some wonderful feedback about the design. One of the biggest improvements in terms of care experience for patients and staff is the addition of more breathing room in our new hospital. It affords so much more privacy, dignity, and respect for our patients, more spaces for therapeutic and culturally safe care, and space for families to support a loved one while in the hospital. Next slide. So this is a timeline that is showing the design evolution of the triage reception desk. The first image on the left is from the indicative design that was part of the business case for the project. What you then see on the second dot is the initial design by the design team that was selected to take on the project. This was based on initial user group meetings that were done during the pursuit, but not extensively. Not shown on this timeline, the next step was actually members of Parkin's design team and the Island Health clinical team did site visits to West Coast General and Nanaimo to see the triage layouts in those areas and understand how they worked. Then the design team and construction team and user group team underwent one-to-one paper and cardboard mock-ups, so first opportunity to see the real scale of this space. They received feedback, and then the design was revised. Then began the fully constructed one-to-one mock-up process. This is done on the job site in a Quonset hut at the back of the site with complete full-scale construction. And the mock-up was built based on the design in that moment. The team conducted interim reviews while it was under construction. There was feedback given, and the design team made further revisions, at which point the contracting team rebuilt the triage desk itself. The user group then once again reviewed it and recommended more changes, and that was finally accepted. So this has really resulted in a far more evolved design approach, and this really highlights patient and staff comfort and safety. Next slide. So this image shows the triage and registration desk, as well as the waiting area and the volunteer workstations from the viewpoint of someone who's entering the main emergency department entrance doors. You can see the curved flooring, which is following the theme of the Cowichan River and its tributaries. And you can also see significant wood finishes, which have followed engagement with Island Health user groups and the Indigenous Advisory Council and community outreach. Next slide, please. And these are some more images around this space, the entry triage area. It shows the expansive windows, which provide a far more inviting space for those waiting for care or those with family or loved ones. And this design, through user engagement, has prioritized patient safety and comfort, sightlines, ergonomics, and workflow improvements. Hand this one over to Pat.
So this is, that's in that psychiatric emergency area on the north side of the emergency department. And this is just a rendering of the patient lounge, looking out into a secure outdoor courtyard for them. There's also, through those windows, you see the Nursing Collaboration Center, and down immediately adjacent down the hall is their medication room. So again, this went through extensive interaction with both the MHSU user group and the emergency user group to bring this design to fruition. Next slide, please. So really the design process has been incredibly rewarding, and we have to thank all of the people that we worked with, our frontline nurses, our doctors, midwives, RTs, all of those individuals were so helpful to us, our Indigenous patient partners, the Indigenous Advisory Council. Without their input, without all of their hours that they spent with us, laboring over these designs back and forth, we would not have been able to achieve a result which I think will be of enormous benefit to this community. Next slide, please.
So lastly, we'd like to thank our build team, who's taken us incredibly far in just one short year. It was February, I believe, of last year that they really started moving forward on construction, and you can see here there's several stories of concrete and everything that goes with it. It's moving along, and it's really exciting. So just wanting to cover a couple things. Our webpage, email box, and Island Health social media channels are the best way to follow progress or get involved, and we welcome your questions and feedback as well as job inquiries. And you can also let us know if you would like to receive updates and news directly from our team. Thanks very much.
Thank you.
Well, thank you so much. The emergency department is always so exciting for everybody, and really appreciate your focus on the patient and their loved ones who come with them to the emergency department. So thank you for your leadership there. So I'm going to open the floor to questions, first of all to the board. And any questions that you wanted to ask of any of the presenters? So I just so you're not wondering why the board has no questions, in case they don't, we were in a board meeting all last week, and so we've gotten a lot of updates there. But this morning we had breakfast with the Alliance group, and it was, I think, one of the best discussions I've ever been involved in. So lots of information came via all of those various mechanisms. So, no, you're good?
Other than how do we pronounce Shane's last name?
Well,
So, Sophia.
which seems easy until you see it on paper, and then it goes kind of... Okay. So I'm going to open to questions.
Thank you. My name is Tom Duncan. I'm on Duncan City Council. Been on there for 15 years, so I've sort of been there as we've tried over almost 2 decades to get a new hospital. And I recognize this is a great looking facility, and it's going to really benefit our community. My question though, and as I know that there's going to be a lot of reasons why you wouldn't adopt my idea, my idea is that we are losing individuals in our community because we don't have services. My question is, what are you going to do with the old hospital? The old hospital, to tear it down, I know from tear downs that we've done through the city, it's going to have asbestos issues, so it's going to be a huge cost to tear it down. It's 121 beds at least. We need mental health facilities here, and we need rehab. I believe that the hospital should be kept intact, and I know you'll have hundreds of reasons for not doing it, but to wait the amount of time we've had to wait for this hospital and to wait for mental health facilities and rehab facilities, we're going to have too many people die. So it really is the best use for that old building is to be converted into mental health facility and a rehab facility for this community, because we can't wait. We're losing too many people every year. So the question is, what are you going to do with the old hospital? Please keep it intact and find reasons to use it for those services that we desperately need.
Thank you for your question. Kathy, I'm going to turn to you.
Yes, thank you, and I'm sure one of my brighter colleagues will be able to give you a more clear answer. So it's, first of all, I want to thank you for your leadership in your community and for advocating for the people whose voices are sometimes not heard. We have not had that discussion about what's happening with the old site. I think in terms of the work plan, there is a planned public engagement for that discussion happening later on this spring. And I know there are many ideas of what to do with the current site facility and the land there. So really encourage your voice to be part of that consultation later this spring and bring those needs forward. And you make an excellent point, and they all should be put as part of the mix of consideration for future use. I don't know if you'd like to address this one, Wesley? Yeah, can I say what?
If I can just add a little bit, thank you, Councillor Young, for that. We'll have a public forum likely in the fall rather than in the spring, just because we're busy on operational readiness. We're crescendoing the wave of design right now with Shane and the team, and then we're going to focus on operational readiness because that's the next large tranche of work that we have to do. Once we've done that, we'll start to think about the site. So it's likely September. We realize there's a petition out in the community. We want to hear from the community. Nothing's been decided yet. The facility, as you've said, is old, is likely to have issues with, contamination, lead paint, asbestos, etc. We have to work our way through all of that. So that is to come. So no decisions made yet. We will have a community forum and have a discussion, an open discussion then.
There is also an individual that is currently working on a petition in the community.
I talk to Peter regularly.
Peter, him and I have had some discussions too around what the old facility really should do to continue to benefit our community.
Great, thanks very much. So I mentioned earlier that we were live streaming, and I do have one question that came in by email, so I'm going to ask that question now and then go back to you in the audience. So here's the question. Access to childcare near the hospital is a major recruitment challenge. Is there consideration being given to daycare at or near the new hospital?
Thank you for the question, and it is we have a Health Human Resource Task Force that's been actively working on the challenges around our workforce and recruitment. And this item has been a live discussion for the last 18 months in every community on the island. As we sit today, there isn't a plan for on-site childcare if you look at the design. That said, we do have a team that's working on securing partners who want to partner with us around proximity, areas around proximity to our hospital sites to provide childcare services for our staff. In particular, the age group of under 3 and for shift workers, those are difficult childcare environments to find. So putting this out there, if there's anybody who's in this business, we'd love to talk to you. And partnership would be how do we come together around space and what can we do as Island Health to support that. I also understand the Bell McKinnon local area plan has a plan, and the municipality in North Cowichan have a plan for some commercial development and business development around the hospital in proximity. And again, we'd be happy to be part of the discussion about what that would look like in terms of our role as a partner.
Thank you. Questions from the audience? Go ahead. Okay, go ahead.
I'm Gretchen Argy. I work with the Vancouver Island Federation of Hospices, and we serve the communities for the whole island and the Gulf Islands. I used to work with Cowichan Hospice, and so the first thing I have to say is thank you to all of you for your support for such a collaborative project that has served the community so well. I'm hearing such wonderful stories about the care not only patients but families get there. And the innovative model of having that managed through community palliative services is fantastic. I think it's really working well, only place on the island, so thank you. I'm here really to ask you a question about grief care. So given that growing, certainly our aging demographic is one piece of what we're seeing, but the growing pandemic of people grieving deaths from toxic drugs is having a huge impact. We did a little snapshot across the island about a year ago, and one hospice replied that they, in their traumatic and sudden loss group, had half the people in that group had lost someone to toxic drugs, and that in fact in the previous 3 weeks she had seen 4 new clients who were grieving those kinds of deaths. And those are often, as you can imagine, isolated, somewhat stigmatized experiences for people. So that support and that group support is really important. Hospices also are interested in continuing to come alongside Indigenous and organizations like Cowichan Tribes and Quenestastal Health to provide support for caring for people who are experiencing terrible too early deaths, and also the reignited grief from residential schools. So those pieces are all real needs on the island. The Cowichan, the hospices on Vancouver Island have been providing grief care for about 40 years with skilled staff and volunteers who are trained, supervised, all those kinds of things. And also counseling staff. And so there's a real sort of, they've developed to meet the needs in individual communities. They're very well supported by communities, but these new needs, as they're emerging, are really causing waiting lists and causing a huge gap in kinds of ability to cope with those things. So my questions for you really are, first of all, would you like to have a presentation? Would you like to learn a little bit more about the services, the hospice services on the island and the challenges? And we'd be happy to do that kind of presentation with you, or conversation, really. And the other is, we are talking about developing a proposal for the province, or we have a draft proposal for the province, and we would really look to the board for your support in funding these kinds of grief care services. So there are questions there.
Right.
Just embedded. Thank you.
Well, thank you very much. The board is always learning about the variety of services that can be provided, and honestly, it's like this for healthcare, right? So thank you for that offer, and yes, we'll get back to you about that and when we might take that opportunity.
Thanks, Gretchen. And I understand you've been in touch with Jill, our end-of-life care program, and are having this active discussion, and we're quite supportive of that, of endorsing that proposal when it's ready. Yeah.
Well, thank you for being here today. As I think I've mentioned before, as a governance board, we're accountable to you and the people we serve in communities in the Island Health region. And that's why it's so important to provide opportunities like this to hear from you. Thank you to everyone who submitted questions or stood up to ask questions or make comments. And thank you to Kathy, Réka, Shane, and Dr. Gallagher for your presentations. Thank you for people who tuned in on the live stream and who came to talk with us today. I will close the forum now, but very much appreciate that you've come and that you've had an opportunity. And if you think of other things that you want to ask that you didn't quite get around to doing today, or you walk away and say, oh my gosh, I should have asked that, how can they do that, Mike?
Stay after or email ask the board.
Yeah, okay, great. Yeah, thank you. Thank you.